Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based, fact-based answers to your weight questions, you are in the right place. Welcome. Before we get started, Consult Week is next week, the week of July 28th. At the time of this filming, at the time of this posting, there might be a spot available. Sometimes people reschedule. I'll leave the link in the description area, but if you are on a GLP-1 and you're still struggling with your food, you can't get yourself to exercise, your lifestyle is still very chaotic, you know the medication can't do everything for you, or you're not on a GLP-1 and you want to do all the things to make sure that you never need to start one, I do work with people around the world as a life coach to help them with the non-medical aspects of their weight loss as well. So I'll leave all that down below, but Consult Week, the week of July 28th. If you're interested, keep an eye on the bookings page. Before we get started, as always, I can't answer personal medical questions because I'm not your personal doctor. So if your question does lean a little personal, I'm going to change it so it's more broadly educationally applicable. And let's get started. First question, how can you prescribe this horrible drug? Okay, this was in relation to the Mounjaro side effects video. Well, it's because I don't see it as horrible. All drugs have side effects. Tylenol has side effects. Advil has side effects. Over-the-counter steroids have side effects. Like any medication you are thinking about taking, there are going to be pros and cons. Now, there are certainly some medications that are more toxic to patients than others, and we know that they are more likely to have more severe side effects. And there are those medications that we know really, in rare cases people have issues with them, but they don't usually cause significant side effects. For me, when I look at this class of medications, the weight loss medications, and as someone who has worked in primary care for over a decade now, I know what happens when people do not treat their overweight or obesity. And I know what happens when people are not able to get their BMI down to a healthy level. And treating obesity, treating overweight is such an efficient way to get people healthier. It's so efficient that I decided to change the entire focus of my clinical practice because I truly feel, now I still do some primary care work, but the majority of my time spent treating patients is now very focused on weight medicine because it can do so much for people. When you get somebody's weight down, it helps their cardiovascular health. It helps their liver health. It helps their joint health. It helps lower their risk of many different types of cancer. It helps lower their risks of diabetes. Like I could go on. And that's not even touching how much it helps people and their mental health. So, I think there are still a lot of people in America, in the world, who think that these medications are terrible, horrible, have so many side effects. And to that, I would say they do have side effects. They have side effects just like any other medication. I think a lot of times the side effects actually come from people who are on the medication and aren't monitored appropriately. Things like small bowel obstruction, that's really, we can think of that as end stage constipation, right? So is there somebody who's going to take it and get that immediately in a 1 in a million chance? Yes, that can happen. But usually these very severe side effects, a lot of times we are able to catch them before they become severe. Like anything in medicine, the goal is always catch things before they progress. And so that is what happens with a lot of side effects is if you don't monitor people, if you don't keep a close eye on them, if they don't know the plan, if they don't know what to do, if they are not feeling well, then yes, things can get very serious. But luckily, in my experience, that is incredibly rare. And I will also say, I do feel that the benefits of this class of medication as a whole, for the right person, far outweigh the risks. And it's also, as always, it's a ongoing discussion between the patient and their doctor. So this is always 100% at the end of the day up to the patient whether they want to take something or not. And it's the doctor's responsibility to let them know what the risks are, what the benefits are, so they can make the most informed decision. So for me, if I am offering to prescribe this for somebody, I am really feeling like the benefits outweigh the risks. The patient knows, and I know that I can't predict the future. But that's with any medication. With any medication, you are taking the risk that somebody will not react well. That's always, always, always a risk. But there's also a risk of not treating overweight and obesity. And so that really comes down to the whole patient-physician relationship is navigating that together and deciding on the best course of action for that particular patient. So in short, I don't think these are horrible medications, but other people might, and that's okay. Like everybody is entitled to their opinion, and you certainly don't have to take these medications if you don't want to. But for me, at the time of this filming, I feel like they are extremely helpful, and I do really feel that the benefits far outweigh the risks when I am prescribing them to a patient. So thank you so much for that question. Next question is, this is in response to, I posted a video recently about what to do if your insurance has denied your GLP-1 medication, and I will leave the link to that video in the description box down below. Okay, great workarounds. The very best cheap weight loss med would seem to be generic Qsymia, 11 to 12% body weight on average, within shouting distance of semaglutide. Yes, so in the previous video, I have discussed the possibility of moving to Phentermine if somebody's an appropriate candidate and their medication, GLP-1 medication, is not covered, as an alternative to kind of fit them in this gray zone of they're not on anything if they can't be on a GLP-1. And I want to clarify that I really see Phentermine as kind of the first jumping off point for oral medication. So I really do feel like it works the best, and then you can add things on. So like this viewer has commented, one of the great things about Phentermine is that you can, for the right person, combine it with topiramate. You can also do Phentermine and Contrave, which is bupropion and naltrexone. You can also, for the right person, do Phentermine, topiramate, and bupropion naltrexone. You could also, for the right person, do Phentermine, topiramate, bupropion, naltrexone, and metformin. Like, of course, it has to be the right patient. It has to be the right person. But these are all places you can go if it works for the patient in terms of oral medications, and you can get pretty close to where semaglutide may start to work. And it is a good compromise, I think, if you can't get a GLP-1. You're not starting at zero. Again, these medications, especially combining them together, that's not going to be the right fit for everybody, but Phentermine is a great place to start, and then you can always build from there. And there are actually some good interim gray zone solutions. So thank you so much for that question. All right, next question. I'm on Adderall and prescribed Phentermine. I don't get any symptoms besides headaches. Is this okay? Well, I don't know if it's okay for you personally, because I'm not your personal doctor, but I will say that we do combine different classes of stimulant medication. So what the question here is addressing is, I'm on 2 stimulant medications. Is this, in theory, something that can be done? And the answer is, for the right person, yes. Now, just within the realm of ADHD prescriptions, there are many different combinations, and a lot of people are on a combination of extended release Adderall and immediate release Adderall, or extended release Concerta and immediate release Adderall. Like there's many, or Vyvanse, or there's many different permutations of different lengths and strengths of stimulant medication in that pharmaceutical category. So yes, we do that sometimes. So technically, for the right patient, I could prescribe Adderall and I could prescribe Phentermine. I don't love doing it because I have to be very careful. Again, it really has to be for the right patient. They're usually younger. They cannot have any cardiac issues. They cannot have any history of seizures. They cannot have any substance issues. Like, there's a lot of people that combination is not going to be a good fit for, but in theory, there are some people that it could. So if I had a patient who was on Adderall and then they couldn't take any GLP-1 medications for whatever reason, it's possible that for the right person, you could add Phentermine to that. So the short answer is, in theory, it is not a complete contraindication. It is a little tricky because it's 2 stimulant medications, but we do that when we're treating other conditions as well. It's just something, you always want to be prescribing carefully, but it's just there are less people that it will be an appropriate fit for. But that is an excellent question. I think a lot of people out there probably have the same question. So thank you so much. Next question. It feels like I'm in a catch-22. I have no appetite after injection for at least a few days, but I'm somehow supposed to eat 150 grams of protein a day to maintain muscle mass. I've tried forcing myself to eat and it's awful. It's just frustrating overall. Oh, that does sound frustrating. Yes, so this does come up for people. Now, first of all, everybody's protein goal is going to be a little bit different. For anybody's personal protein goal, talk to your doctor. A good ballpark range that I've discussed in the past is thinking about somebody's ideal body weight, the goal they're shooting for in kilograms, and the protein goal is often 1 to 1.2 grams of protein per kilogram ideal body weight per day. And my rule is always, I never want somebody to eat at the expense of their fullness. I do want people to get an adequate amount of protein, and that is very important. But what is also important is respecting your body's hunger and fullness cues. And I never want somebody to force themselves to eat protein at the expense of their fullness. Now, this is in a separate category. Then there are these people who, when they start the medication or they bump up on the medication, they just have no appetite. And then we have to do some creative problem solving with their meals. And I'll make a whole other video about that. But that's not what I'm talking about today. I'm talking about somebody who's eating 3 meals a day. They are getting in adequate nutrition, but they are really struggling after, they're full before they've gotten all their protein in. And do not mishear me. Protein is important, but it is also important to learn to listen to your body's cues. So maybe there are some days for my patients where they don't always hit that protein goal 100% of the time, but maybe they're close. But I would much rather, top of the priority for me is that they are stopping when they are satisfied but not overly full. That is how a lot of people get into trouble in the first place, is that they are not listening to their body's cues, and they're eating and stopping eating for so many other reasons other than their own natural hunger and fullness. Nobody knows when they're hungry and when they're full and when they're overly full. And that's a really big problem. And it's still a problem for people who are on GLP-1 medications because nobody taught them how to do this. And so it is nice that this medication has a stronger signal. So people are finally sensing it. But again, you can still ignore it. And I think we tend to do that. When people do that, you're really doing it at your own peril. So if I have a patient and they're really consistently struggling with meeting their protein goal, that's definitely somebody that I want to have a longer discussion with. But if somebody's eating, a regular amount of meals, but they're just not always hitting that protein goal 100%, I never want them to eat past the point of, satisfied but not stuffed. I don't want them to do that for protein. But if you are struggling with that, you should have a extended conversation with your physician and make a game plan on what your goals are. But top of the list for my patients is honoring their hunger and their fullness. That is super important. That is not something that people learn in today's society. And so now a lot of people are learning it for the first time when they're on these medications. So that is a great question. Thank you so much for sharing that. That's going to do it for today. Thank you so much for watching. If you have questions afterwards, you can leave them on this video. You can leave them on another video and I will find them and add them to the list. If you're on a GLP-1 medication and you are still not seeing the results you expected, you are not alone. These medications work really well, but they work best when they're combined with healthy, sustainable habits. These medications do not do everything for you. I do work with people around the world as a life coach to help them with these non-medical, sustainable habits that will help reinforce your results on your GLP-1 medication. If you're interested in learning more, you can definitely book a consult. I will leave all that information down below. If you're not subscribed to this channel, subscribe because it's the place for medically based answers to your weight questions. Thank you so much for watching and please be well.